Yes, many thanks for staying tuned with us on Frontline this morning. Now we'll move on to the interview segment of the show. And today we are going to draw our attention to a crisis that remains dangerously under-recognized, and this continues to toll the toll of viral hepatitis across Africa continent. And this year's theme, hepatitis, let's break it down, challenges us to dismantle the many barriers, medical, structural, and social, that prevent millions from accessing the care that they need. So today, more than 70 million people according to World Health Organization, in the African region are living with chronic hepatitis B or C, and every statistic is a person whose future is under threat from a disease that is both preventable and treatable. And also looking for that this morning is a report coming from the WHO appealing to the government and health partners to accelerate efforts to eliminate viral hepatitis following the reclassification of hepatitis D as carcinogenic to human. So joining us to have this conversation as we look at the theme for this year, World Hepatitis Day, that is hepatitis, let's break it down, is Dr. Saul Adeleke. Dr. Saul Adeleke is the Senior Registrar, Clinical Pharmacology in UCH here in the city of Ibadan, and an advocate for liver disease and cancer. Many thanks for joining us this morning, sir.
Thank you very much for hosting me.
Yeah, I think thank you so much. I think it's very important for us to start from the basis, and let's talk about what exactly is hepatitis from the medical point of view.
Okay, thank you very much, Ma. Good morning, our viewers. Let's go to the word hepatitis. Hepatitis comes from two words, hepatic or hepatis, talking about liver. It's a Latin word for liver. Then titis talks about inflammation, ongoing destruction. It's like someone has a wound and is suppurating, is making pus. You can press it and something whitish or creamy is coming out of it. So when you say hepatitis, you are saying inflammation of the liver. That is, there is an ongoing inflammation, an ongoing destruction of the liver, as if you are pressing your liver and what looks like pus is coming out, even though in the real sense of it, it is not pus coming out, but there is a serious ongoing inflammation in the liver. So that's how we come about the word hepatitis. Okay. Inflammation of the liver. Okay. That is hepatitis. And now there are various forms of hepatitis. We have the viral hepatitis, we have toxic hepatitis, and many other things. Now, for what we are dealing with presently, yesterday, and essentially the whole of this week, is actually the inflammation going on in the liver due to viruses. And we have a few viruses that do cause hepatitis. The most important of them are hepatitis B and hepatitis C. Interestingly, there's also hepatitis D, but the thing with hepatitis D is that if you don't have hepatitis B, you cannot have hepatitis D. There are other viruses like hepatitis A, hepatitis E, CMV, all manners of viruses that can affect the liver, but they are not that important when you are talking about hepatitis compared with hepatitis B and hepatitis C. And let me shock you. Presently in Nigeria, population of a little over 200 million, maybe some people say 220 million people. We have about 7 million plus people living with hepatitis B infection in Nigeria of today. 7.2 million people. And hepatitis C, we have about 2.5 million people living with hepatitis C. I don't know how many people are living with hepatitis D. I don't know. But it's a big problem.
Yeah, the figure is quite huge.
Yes, ma'am.
And it seems that we are not even paying that attention to it, because perhaps if there are a lot of sensitization, orientation about it, the figure wouldn't have been so high as it's being stated now. But let me ask you that, what are the red flags, as in the symptoms that people should look out for to know that this is actually hepatitis?
Thank you very much, Ma. Let me start from the end. And I will now come to the beginning. By the time someone has clinical symptoms, signs, to suggest that, oh, could it be that this person has a liver disease? And then they start testing, doing all manners of tests, investigations, and they now say that, oh, it is hepatitis B, it is hepatitis C, it is hepatitis B and D. I'm sorry, most of the time, the person just has few months to go. So it's better never to get there. I've said it on this station a couple of times, the story of my mother. By the time I discovered that it was a liver issue, my mom had less than 6 months to go. Oh. There was nothing to do. It was already liver cancer. There was nothing to do, absolutely nothing. And that's why I'm an advocate. The same thing that affected my mother killed her immediate elder brother almost 4 decades earlier. That's very interesting. Almost 4 decades earlier. And about 3 decades earlier, it killed her own mother. But, you know, in Africa, we attribute illness, this or that, to witchcraft, to village people and things like that. That is how they explained her elder brother's death in 1977. Exactly the same thing they did to her mother's death in 1984. And when it was her turn, because I'm a doctor.
It's hereditary?
No.
Okay.
But it's the same pattern of getting it. If I'm a woman and I have hepatitis B, it is possible that I transmit it to my children during the period of birth. While delivering them, a little touch, a little break in skin, and my blood touches their blood, whatever, is sufficient to give it to them. And that's the reason what is advocated globally now is that every child, every mother should be tested for hepatitis B and C. And in case they discover that they are positive, put them on medications, and immediately at birth, there is what you need to do for the children. So it's possible that when my maternal grandmother was giving birth to some of her children, she transmitted the same hepatitis B virus to them. And then, years later, they manifested it and it was terminal. So by the time you are saying symptoms, it is almost always too late. Now, coming back to the beginning, when people contract hepatitis B, C, in fact, most viral diseases, there are no classical symptoms. The person just starts feeling tired, nauseated, you're unable to eat, you don't feel like eating, all manners of funny things. And in this part of the world, they will just tell you that, oh, it is malaria. Then you go ahead and treat malaria. Then they tell you, you did not get better, and they will say, oh, maybe it's typhoid. They will ask you to do wider test. Now, the truth of the matter is, if you bring 10 people who don't have anything, and you do wider test for them, 2, 3, 4, or even 5 of them may test positive to wider test. So what are you doing wider test for crying out loud? For heaven's sake. There's no point doing wider test. So I remember a case I saw in UCH, was it last year or 2 years ago? This young chap had gone to a popular hospital in the city of Ibadan, and they said it was malaria. They treated him and he got better. After getting home, it deteriorated again. They said it was malaria and typhoid. They treated him. While he was on admission, he got better. Immediately after getting home, it deteriorated again. Then someone who knows his dad now sent him to us. And interestingly, they had already done a liver function test for this young man. And the liver enzymes were in the ceilings. So the question was, what is affecting the liver? And I asked him, I just looked at him, your eyes are yellowish, jaundiced. Did you notice this before? He said, no. Let's do this. Lo and behold, it was hepatitis B the man got. He just changed his sexual partner. So more likely that he got it from the new sexual partner. And they were treating typhoid and malaria, but it was hepatitis B that this man had. So I just stabilized the guy, I referred him to the hepatologist, and since then he has been doing well on his medications. So what looks like malaria may actually be hepatitis B, hepatitis C, or hepatitis D, or many other things. And that's the reason we advise, don't go to places where they are not sure of what they are doing. Go to places where they are sure that, oh, this is what is wrong. And I'm not under any obligation to know to have all my diagnosis right. There are times that I will tell you, I'm sorry, I'm not sure what is wrong with you. Do you mind going to another doctor? And I will ask you to see another doctor, or I bring another doctor in to attend to you. I'm not under any obligation to be 100% right. I'm a human being. I'm not a machine. Even machines get it wrong once in a while. So let's look at it very well. Go to good hospitals. And if the doctor is not sure, let him bring in another person. Second opinion. And then, that way, I think we will make a headway.
So if viral hepatitis is left unchecked or untreated, are there other complications that may arise from it?
Yes, ma'am. Okay. This is the thing. There are millions of people who have come in contact with hepatitis B, hepatitis C, plus or minus hepatitis D, and they are doing well. Nothing may happen to them. But at the same time, there are millions of people that hepatitis B, hepatitis C will stay with the liver and slowly but steadily destroy the liver. Now, how do you know whether the virus will affect your liver or not? Nobody knows. Only God does. So that's the problem. And that's the reason, just get tested. And once you are positive, they will do a number of examinations, investigations on you regularly. There are people who don't need medications. Yes, we know they have hepatitis B, but they are doing well. It's not affecting their liver. And they tell them, come back after 6 months or come back after 1 year. They test you again and again to be sure that nothing is going wrong. And immediately they spot that something is going wrong. They put you on treatment and you will be fine. Okay. If left untreated and it's affecting the liver, by the time the person realizes it, most of the time, the person has just a matter of months or a few years to go.
You've mentioned multiple sexual partners from the case you cited as being one of the lifestyles that can make people vulnerable to viral hepatitis. What are other lifestyles that people imbibing that can make them to be vulnerable?
Okay, basically hepatitis B, hepatitis C are contracted through body fluid. So anything that can make the body fluid of one person get to you is sufficient. Now, I have a little cut in my finger here. Okay. If I'm going to the hospital now, I'm going to put a plaster on it so that no matter what, nothing can get to that little cut. Because all it takes is just a small drop. For instance, let's assume that someone with hepatitis B, for whatever reason, bled, and his blood is here. And you just wipe it off. Are you aware that 6 months after, if you have not disinfected it properly, just a little scratch on your finger, you just rub it on it, is sufficient to give hepatitis B? That's the problem with hepatitis B. Similar to hepatitis C too. You use the clipper to barb or shave for someone with hepatitis B. The person had a little cut, just a small drop of blood on that clipper. And you use the same clipper without properly cleaning it, sterilizing it, to barb for another person. And the person also suffered a cut. Now the blood of someone with hepatitis B had gotten to broken skin on the other person.
Just like HIV/AIDS?
Exactly.
Okay.
They are not different from one another. So the person just gets it. Or, oh, there's an accident somewhere. Oh, let's help them. And you carry someone not minding the blood on the person. And then the blood that already has hepatitis B or C gets on the broken skin of yours. Sex. And that's the reason. If people are going to get married, test them for hepatitis B, test them for hepatitis C, so that the partner that is negative will remain negative for life. Otherwise, while they are doing the husband can transmit the hepatitis to the wife, or the wife to the husband, if they are discordant. But if both of them are negative, oh good. If both of them are positive, treat both of them if necessary. And that's how to do it.
All right. According to statistics, the African region accounts for 63% of all new hepatitis B infection globally, a reflection of deep and persistent inequalities to access to vaccination, testing, and treatment. And too many people continue to face stigma, misinformation, and also delay or missed opportunities for prevention and care. So what would you say are factors that are responsible for this poor access to vaccination, misinformation, and a lot of misconception about viral hepatitis?
It's deep. How did Europe, especially Western Europe, North America, get over their own issue? Because it was horrible with them too. In fact, Egypt used to be the world capital for hepatitis C, and then they decided that no, we can't be the world capital for hepatitis C. So their government decided to work on it, and now it has gone down significantly in Egypt. What do we have here in Nigeria? And not just Nigeria, the whole of Sub-Saharan Africa.
Yeah.
Do we have enough doctors? Are you aware that if not for the withdrawal of one memo last week,
you guys would have been on strike.
Doctors all over Nigeria would have been on strike. Now, are you aware that doctors in Lagos State are on strike right now?
And nurses are planning to join.
Nurses are going to start. All nurses working in federal government hospitals in Nigeria are going to start their strike by 12:01, meaning that they have just about
less than 4 hours.
No, 12:01 a.m. of tomorrow.
Okay.
Meaning that they have just about 14-15 hours to start a strike. This is the problem. When World Health Organization is recommending one doctor to this number of people,
patients, and
here we are not even close to it. We are very far from it. In sane climes, I did not say saner climes, in sane climes, you come in to see a doctor, and the next 30 minutes, 1 hour, the doctor is attending to just only you, because he needs to explore everything. Everything you have come with must be adequately addressed. And in the bit of addressing what you came in with, we identify things that may be wrong but are not of concern to you. So ultimately, they do not only do curative medicine, they also do preventive medicine. But here, when you have about 20 patients to attend to and you have just 2 or 3 hours to run the clinic, by the time you are done with the first 3, 4, 5 patients, you are already worn out. So the next set of people coming in is just a matter of their complaints are coming in from this year, exiting from the other. Before you know it, you have already written prescription, go and do this and things like that. So we are not adequately taking care of people. We are only taking care of their conditions, their health issues. Nothing more than that. And that is the problem. We should move from ordinarily curative medicine to preventive medicine at the same time. But when you don't have enough people to manage our health sectors, I put it to you that there are general hospitals in this state where they don't have a singular doctor. So these are parts of the problems. So many of them, and it's not limited to Nigeria. If you give me the opportunity to japa too, how many people will not japa I remember where I work, adverts came out. They wanted to recruit doctors, but people did not even apply.
Imagine.
So Nigeria has a significant shortage of doctors, and not just doctors, nurses, pharmacists, and everybody, because everybody wants to go to Europe, to US,
UK.
the US, Canada, because it is apparently better for them over there than here. So what do we do here? We continue to soldier on, do the best we can do, advise people, and it's good that you have a platform where you educate the populace. And this is what I recommend to as many places, establishments as possible, even to churches and mosques. I remember I was in a Baptist church 2 Sundays ago to talk about your liver and you. And we trashed this. I don't know how many people have decided to go ahead and test themselves for hepatitis B and C. These are little things that we can do. And I hope that my audience, my viewers, as they are listening, will take that step of faith. Let me go to the nearest hospital and find out where I can check for my hepatitis B, C status. And if you are positive, where do I go from here? And then we can start defeating this disease, because the plan is that we will reduce it significantly. Defeat it by 2030. That's just less than 5 years from now. And
so
the question
is possible.
It is possible, but are we ready? Is the government ready? Are our healthcare personnel ready? Are our hospitals ready? Is the population ready? Those are the big questions.
So for government to be ready and for medical practitioners to be ready, what do you think are the things that they should put on ground?
Well,
I know you've stated the max exodus of medical practitioners, but what other things do you think the government is willing to do more? And looking at the report coming from the WHO this morning about the carcinogenic hepatitis B, that government should be proactive.
Well, the government has a lot to do, but unfortunately, everything starts and ends with them, essentially. Because if you don't have people that can take care of it, what do you do? Okay, how many liver specialists do we have in the whole of Nigeria? I'm not sure, I don't have the facts. But in Oyo State, if you count all liver disease specialists in Oyo State, they are less than 10 in the whole of Oyo State. In the whole of Oyo State, 35 or 33 local government areas. All of them are essentially in UCH, except if you go out of UCH to see someone in a private hospital or that. So all of them are in UCH. Go to our flagship. Okay, I'm not sure if they have another. Okay, there's someone at Lautech Teaching Hospital now, because the person that was there also left. But thank God, I know the person that is there now. So in Ogbomoso, one person. In UCH, maybe 5, 6 or so specialists. If you put the senior registrars there alongside everybody, we are still talking about less than 12 people that can adequately take care of liver disease in the whole of Oyo State. And we are fortunate here. There are states that they may not even have a single person. So that's the problem. So it starts with you produce doctors and you keep them to handle the issues in your country. Enough of, we graduated 1,500 doctors in 2025 or in 2026, and less than 5 years later, you have less than 100 of them left behind. That is where we should start. Specialists. And how do you keep specialists when you know that, okay, I'm saying this not to attack the government, but how do you handle the issue that the best paid doctor in Nigeria earns less than 12 million naira in one calendar year. And the government of Nigeria wants to send some doctors from Nigeria to St. Lucia in the Caribbean. And they will be earning about 50 million naira in that place. But the ones staying in your country earn less than 12 million naira per annum. Meanwhile, the ones you are sending to St. Lucia will be earning almost 50 million naira per annum. The government of St. Lucia will give them free accommodation, free vehicles, free feeding. So, do you think, if you're a doctor, do you think you want to stay back in that place? Or you want to go to the UK, Germany, the Netherlands, Australia, New Zealand, the US, Canada, or even let's say Saudi or Dubai, where you earn, and you work 1 year, and what you earn in 1 year is more than what you get in 5 to 10 years in Nigeria. These are some of the, and am I saying that the government should increase my salary or the salary of anybody? Not necessarily, but there are many things that can be attached to work. You are a healthcare worker. Oh, we will subsidize this thing for you. We will do this thing for you. Oh, because you are a healthcare worker, okay, you are entitled to car loan of this amount. You are entitled to many other things that at the end of the day, you keep them. People are not, it's not because of money that everybody is running away. Yeah. People are looking for their own security. And by the time you do all those things, more and more people will stay behind. After all, some of us have chosen to stay back in Nigeria. So for whatever reason,
everything still stops on the government table.
Everything. Let's address those things. We have enough hands. We are producing enough doctors in Nigeria, and they are staying back. Then we address all manners of issues. Why have we not defeated malaria in Nigeria? There are countries all over the world that have defeated malaria. So many things that can be handled, but everything starts and ends with the government. Then the population is just like the word of God that I can't remember how to quote it, that do not harden your heart. That when you hear things like this, take that step.
So as a way of you addressing the population and wrapping up, just let's talk. So you talk about how to prevent viral hepatitis, because they say that prevention is not just better, it's even cheaper than cure. So as a way of you talking to the populace as we round up this segment.
Yes. The first thing, know your status, treat if necessary. Are you married? Let your partner also know his or her status. Are you intending to get married? Let him or her know his or her status as soon as possible so that you can start treating. Do you have children? Let them know their status. If they are negative, let them get the vaccine. It's the cheapest thing. Okay, to get tested will cost you possibly less than 5,000 naira. In fact, in my church, someone volunteered to get the kit. They brought it to the church. They tested as many people as were interested in getting tested. Yes. And immediately we picked some people that were positive. We gave them a referral letter to UCH, and they are on their treatment. So get your children tested. If they are negative, good. Let them be vaccinated. Vaccination stops hepatitis B especially. It's the most deadly form. Just get vaccinated. It is so cheap. Then, if you are positive and you are giving birth to a child, let that child be tested and be given the vaccine immediately after birth so that the child does not end up developing it. 7.2 million people living with hepatitis B in Nigeria. Let us know how to eat. It depends on you a lot. Exactly. It depends on me. Yes, I've tested myself. My wife is tested. My children are tested. All of us are negative. How about my siblings? I've told all of them, and all of them have gone ahead to do that. Do you work in an establishment like this? Why not just organize something like, okay, we just want everybody to be tested for this? It's not just about hepatitis B. Once you discuss any condition, is there anything we can do about it? Let's take that step almost immediately. Tested, vaccinated, and everybody will be fine.
All right, thank you so much, Dr. Sol Adeleke, for this insightful time as we look at the theme for this year, World Hepatitis Day, which says hepatitis. Let's break it down. And just as you mentioned, I think the whole thing still evolves around the government and to do the needful, particularly in the area of the mass exodus of the medical practitioner, to step back in the country and look into all of these issues about hepatitis and even every other illnesses as well, and to individual as well. Your own part is just to get tested and to ensure you get vaccinated and treatment when necessary. Once again, a big thank you to Dr. Sol Adeleke, the Senior Registrar, Clinical Pharmacology here in the UCH University College Hospital here in the city of Ibadan, for your time on the program this morning. Thank you so much for your time. I hope our listeners, our viewers, have taken one of two lessons from today's conversation on hepatitis. And one thing I want also to reiterate, that hepatitis is real and it's also deadly, just as
and curable.
And also curable as well, if you do the needful, actually. Yes. If you get tested and also get vaccinated on time before it degenerates. Many thanks for joining us on this episode. We'll take a break now to allow for sport updates with Adebola Adeleke. Do stay with us.